Introduction. Hair loss, also known as alopecia, is a common condition that affects people of all ages, genders, and races. It can occur due to various reasons, such as genetics, hormonal imbalances, medication side effects, stress, and underlying medical conditions. While hair loss is not life-threatening, it can significantly impact a person's self-esteem, confidence, and quality of life. This thesis aims to provide an overview of the causes and prevention of hair loss, available treatment options, medications, and future technologies in hopes for hair loss prevention. Causes of hair loss. Hair loss can occur due to several factors, including genetics, hormonal imbalances, medication side effects, stress, and underlying medical conditions. Some of the most common causes of hair loss are: genetics. Androgenetic alopecia, also known as male and female pattern baldness, is the most common cause of hair loss. It is an inherited condition that affects both men and women and causes hair thinning and baldness. Hormonal imbalances. Hormonal imbalances can also cause hair loss. For instance, an overactive or underactive thyroid gland can cause hair loss. Similarly, high levels of male hormones in women, such as in polycystic ovary syndrome, PCOS, can cause hair loss. Medication side effects. Certain medications, such as chemotherapy drugs, blood thinners, and antidepressants, can cause hair loss as a side effect. Stress. Extreme physical or emotional stress can cause hair loss, a condition known as telogen effluvium. Underlying medical conditions. Certain medical conditions, such as autoimmune diseases, scalp infections, and skin disorders, can cause hair loss. Prevention of hair loss. While some hair loss is inevitable, certain measures can help prevent or slow down hair loss. The following are some ways to prevent hair loss. Healthy lifestyle. Eating a balanced diet, regular exercise, and managing stress can help maintain a healthy scalp and promote hair growth. Hair care. Using gentle shampoos, avoiding tight hairstyles that pull the hair, and limiting the use of heat styling tools can help prevent hair damage and breakage. Avoiding medications. Avoiding medications that cause hair loss, such as chemotherapy drugs and blood thinners, can help prevent hair loss. Treatment options for hair loss. Several treatment options are available for hair loss, depending on the cause and severity of the condition. The following are some of the treatment options for hair loss. Medications. Medications such as minoxidil and finasteride are approved by the U.S. Food and Drug Administration, FDA, for the treatment of hair loss. Minoxidil is a topical solution that promotes hair growth, while finasteride is a prescription pill that blocks the male hormone dihydrotestosterone, DHT, which is responsible for hair loss. Hair transplant. Hair transplant is a surgical procedure that involves removing hair follicles from a donor site and transplanting them to a balding area. It is an effective treatment for male and female pattern baldness. Scalp micropigmentation. Scalp micropigmentation is a non-surgical procedure that involves tattooing the scalp to create the illusion of hair. It is a popular treatment for people who do not qualify for hair transplant or who prefer a non-surgical option. Low-level laser therapy. Low-level laser therapy, LLT, is a non-invasive treatment that uses red light therapy to promote hair growth. It is a popular treatment option for androgenetic alopecia. Future technologies and hopes for hair loss prevention. The future of hair loss prevention and treatment looks promising, with new technologies and research studies being conducted. The following are some of the technologies and hopes for hair loss prevention and treatment. Stem cell therapy is a promising new technology for the treatment of hair loss. The therapy involves using stem cells to stimulate hair growth by regenerating hair follicles that have become dormant or damaged. Stem cells are undifferentiated cells that can differentiate into different cell types in the body, including hair follicle cells. Stem cells can be obtained from different sources, including bone marrow, fat tissue, and blood. There are two main approaches to using stem cells for hair loss treatment: stem cell transplantation and stem cell stimulation. Stem cell transplantation involves the removal of stem cells from the patient's own body and their transplantation into the scalp to stimulate hair growth. This approach is still experimental, and more research is needed to determine its effectiveness. Stem cell stimulation, on the other hand, involves the use of stem cells to stimulate the growth of hair follicles. Stem cells can be used to promote the proliferation of hair follicle cells and the formation of new hair follicles. This approach is less invasive and has shown promising results in preclinical studies. One of the challenges in using stem cells for hair loss treatment is determining the optimal source of stem cells and the most effective method for their delivery to the scalp. Researchers are exploring different sources of stem cells, including adipose-derived stem cells, bone marrow-derived stem cells, and umbilical cord-derived stem cells. Another challenge is the potential risk of stem cell therapy, including the risk of infection, inflammation, and the development of tumors. More research is needed to determine the safety and effectiveness of stem cell therapy for hair loss treatment. In conclusion, stem cell therapy is a promising new technology for the treatment of hair loss. While it is still experimental, early studies suggest that it may be a safe and effective treatment option for hair loss. More research is needed to determine the optimal source of stem cells and the most effective method for their delivery to the scalp. With continued research and development, stem cell therapy may become a mainstream treatment option for hair loss in the future. Subscribing and liking the video are a great help. Thanks for watching.